welcome back to MindFeed. This is a platform where we help you understand why people take drugs, understand your mental health. In case you're going through a lot, you'll know what's happening. You'll know how you're going to help yourself or help someone around you that needs help. So today's episode is going to be interesting. I decided to look for a doctor. He's going to explain certain things that we do not know of. Why do people take drugs? What happens, the science rather, behind taking drugs. So I'll give them a chance to introduce himself properly without me lacking or leaving anything. Hi.
Hello, how are you?
I'm okay, how are you?
I'm great. Yeah, I'm Dewa from the International Wellness Center, which is a drug and substance abuse rehabilitation facility. We call it the wellness because it's not all about the drug. It's about the environment. It's about the entire chain of addiction in terms of treatment. So this is why we call it the International Wellness Center.
All right. So when did you establish it?
It was established in 2016, and this particular facility was established in 2018.
Okay.
Yes.
What made you want to start a rehabilitation center?
Yeah, it's a long story. I've had a very close friend of mine who were together at school, I think from primary, high school, and right through. And he was an avid scholar and someone who had achieved academically. But unfortunately, he fell through addiction. And that really inspired me to investigate and find out, because he had been through a lot of rehabs in the first world in order to overcome his problem, but he would relapse all the time. That induced a sense of, inquisitiveness to find out why. And this is what gave birth to the rehabilitation center.
All right. So did you face any challenges opening it?
Yeah, quite a lot. Some of them are professional secrets that I would not want to discuss in a public platform. But yeah, there are many challenges. But the will to create an environment that can actually address the entire value chain of addiction pushed me to get to this stage.
All right. Since you established this rehabilitation center, up until today, what are some of the patterns that you noticed from your patients?
Right. One of the major salient points in addressing addiction is handling the underlying issues. There's a popular statement that I've coined: no one takes poison willingly.
Okay.
So in other words, there is no addict that just simply takes a drug. There is always underlying issues.
What underlying issues?
One thing that I found out sticking out is our parenting patterns.
Okay.
It's really a tricky one. It's really a tricky one. Sometimes parents themselves would be having their own mental health problems, probably from their childhood, and their parenting pattern is being determined by their traumas that are coming from their past lives, and they then pass it on to the kids through probably they structure their homes based on their traumas, and that then affects their kids, who then would not be able to cope, and that creates that crisis. Also, socio-economic issues. I think a lot of young people are graduating, and when they graduate, they find themselves idle, and they are not able to cope. So that creates a problem. That creates a problem for them. When they can't cope, they try and find pleasure in the drugs and other vices. And another issue, obviously, is kids born out of probably broken families. They are likely to seek relief in other places, and they are easily influenced by others. So because they have a low self-esteem, they don't have a position of their own. They tend to be influenced by others, and that creates a crisis for them. And one of the most profound issues is culture shocks. A lot of young people, they migrate from the rural areas where there is a certain cultural structure, and suddenly they find themselves at uni. And at uni, what will be happening is this is a melting pot where people of different social structures are coming to converge. And they would have come from a very conservative kind of setup, and they get to uni, they get to high school, and then it becomes a culture shock. They easily get influenced by those that are coming from other cultures sometimes. So the culture shock is one of the biggest drivers of drug addiction. And some of the young people that go overseas especially, they find a lifestyle that they've never experienced, and that becomes a driver to drug addiction, because it's a new culture, it's a new setup for them that can unsettle their structures. So it's one of the biggest drivers there, and we need to literally prime the children before they leave. Actually, it's not affecting even the children, it's affecting everyone.
Yeah, I feel like when someone takes drugs, they do not only affect themselves,
Yes.
they affect almost everyone around them. But now my concern is sometimes those people that take drugs, they know that what they're doing is wrong. But how come they do not stop taking the drugs?
Interesting question. We talked about the science of addiction.
Mm-hmm.
What you've got to understand is when you take a drug, there's a full biochemistry that happens internally. The full biochemistry, I mean chemical reactions that then take place.
Mm-hmm.
Most of the drugs that are taken in the streets, or even prescription drugs, most of them probably are opioids. And being opioids, they are also fat soluble. What it means is when they are taken in, besides causing the high, they elicit what we call residual effect. In other words, drugs are then stored in the fatty tissues as what we call metabolites. Now, when they are stored in the fatty tissues, what it means is when the drug levels, I mean the high, if it drops, what then happens is the body will then take the residues, some of the residues from the fatty tissues back into circulation. And that causes what we call a re-stimulation. It doesn't cause a high. The residues don't cause a high, but they cause a re-stimulation because they are in what we call sublethal doses. It means they are below the ability to cause a high. But they are at a level where they can stimulate or remind someone to top up.
To top up.
Yes.
So what if you start taking drugs maybe only once a week?
See, the stimulation means what happens is the stimulation means you are being reminded to top up.
Okay.
So it becomes a cycle. Now you're saying, by the way, the question again?
The question was, when you take drugs only once a week,
Yes.
what then is only once a week or even once a month?
Yeah.
Would that be a problem? Because some people take drugs that are prescribed.
Yes.
These are drugs that you doctors give us,
Yes.
meaning that they also help us. So if I'm taking these drugs only once a month, would that be something wrong?
Right. Prescription drugs, that's why they are prescribed. It means you are given a certain period of time to take them,
Okay.
which will not induce your addiction, except those that have got probably as a post-operative after a procedure. You may take a drug until you get addicted.
Okay.
But if you check very well, if someone is taking prescriptions, the doctors know that this can cause addiction. This is why they will say take this 2 times a day for 7 days.
Okay.
Do you see what I'm talking about? For 7 days. So that we avoid what? Addiction.
Okay. So
Yeah.
what material or ingredient is used for drugs that makes them so addictive?
Right. I told you about opioids. These are chemicals that can be used for pain control.
Okay.
But at the same time, excessive intake of such will cause addiction.
All right.
So, in other words, their administration for health purposes, there is certain doses that are given that are safe for that individual. That's why it will be clearly written. If it's in tablet form, take 2 tablets in the morning, or in the evening. It's take these tablets twice a day, 500 milligrams.
All right. So these are not the only drugs that people take. There is Bronco as well,
Yes.
which is smoked,
Yeah.
and then there's marijuana.
Yes.
Which one would you say has the worst effect?
Well, it's. I'll give you bad news. None is better. Right. Why am I saying that? I'm saying, you see, the cannabis being a plant and all that, it would seem like it's nice. It's giving a relief and all that, and Bronco has got immediate effect, which is codeine, which is an immediate effect and all that, and you feel that this is the worst. The other one, it's killing you nice and slowly, and the other one is killing you instantly. But the same thing is, you die.
You're dying still.
Yes, you're dying still.
What about, there are these smoking things that people use.
The e-cigarettes.
Yes,
Yes.
I think, I guess.
Yes.
The ones that are not literally cigarettes, but then
It's cigarettes.
they say it's flavored A.
Yeah, that's correct. These are, they are called e-cigarettes.
Okay.
Their street name is, what do you call them? Okay, just the shishas and
Yes, the shishas.
The
I don't
shisha.
know how I forgot their name.
there's the shisha and the smaller gadget, which
Yes.
is these are electronic cigarettes that are created in the tobacco world. How they were created was, the idea was, like you're saying, it's flavored and all that. But what I would like you to understand is, those flavors are not registered in materials.
Okay.
Being non-registered, no one knows the chemical composition of those. Not knowing that, in a lot of cases, they are laced with actual drugs. A case in point, we ran some tests on some of them, some of the flavors, and we found some low concentration barbiturates, which is basically when I'm talking about barbiturates, I'm talking about anesthetics that are used during surgical procedures,
Okay.
but in low concentration. Because these are imported, and being imported, no one is regulating them, no one is testing them to see what are the actual flavors. No one knows the chemical composition of the flavors. All we know are the colors. And sometimes they are minty tasting and all that, yes. So that's as far as we know. But if you look at the Crystal sweets, you can even know the composition. But those ones you can't.
Okay.
Yeah.
So are they also bad?
Very bad.
Because from the advertisement, they say, no, this is just flavored A. There's nothing wrong with this. They are not like cigarettes.
But it's nicotine. Right. I think just from a layman's point, if you give it from a layman's point, the lungs are designed to contain certain quantities of air.
Okay.
And remember, when you are puffing, when you are taking those e-cigarettes, when you take a regular cigarette, you can take one and take the other one after 2 hours. But when you take this e-cigarette, how long will you be taking? Every 5 minutes. You are pumping in. So in terms of just the volumes of air that you are pumping into the lungs, it's enormous. You're injuring the lungs. This is why now there is actually a disease that comes out of that, where those that have died through it, they will discover a lot of perforations in the lungs. What it means is you are injured in the lungs internally. And then from a medical point of view, let's look at, even if it's low doses of nicotine, what you have to realize is you are taking every 5 minutes. So you are multiplying probably 30, 40 times the nicotine intake, because every 5 minutes you are puffing. You see that by the end of the day, and also it becomes very impulsive.
Yes.
The frequency actually creates an actual psychological effect and psychological addiction, where every 5 minutes there's a feeling and an urge, not only from the chemical itself, but from the gadget. Because you have to handle it just like a cell phone. A cell phone, if you don't have it, what happens? You look for it.
Yeah, you definitely look for it, and you find it.
Yeah, when you find it, that's when your mind settles.
Yes.
When you don't find it, what happens?
Your mind doesn't settle.
You get agitated.
Yes.
Yes.
That's so true.
That's exactly. It's a gadget that you use every 5 minutes, so you become obsessive.
Mm-hmm.
And obsessive disorder comes into play when you're using those gadgets.
All right. So from your observation, what makes other people leave drugs for good and others do not leave the drugs?
Two things that come into mind. The first one, like I said to you, drugs induce a biochemical reaction internally. While the mind may say, no, I don't want this, but biochemistry will still dictate that, please take it. Why? Because you are not in control. Probably part of the cycle, the addiction cycle that happens internally, is such that the drugs actually migrate one's mind into the addictive world, where you lose control. Remember that what makes a person do it over and over again is because he has lost control. When you lose control, it means you are now subject to the drugs machinization internally. It means the drug, when someone is high, he operates on what we call manufactured thoughts.
Okay.
Manufactured thoughts that are manufactured by the drug, because it is that thought process that has been adulterated that gives you a poor decision-making ability. That's why they will sing when they're not supposed to sing. That's why they develop a language. For example, if you look at people that take crystal meth, they are so evident. There's extreme delusions, extreme paranoia. They see what we don't see. They are migrated into a world where when they are seeing one person, they see 10 people. And I think you have seen some of our musicians when you guys are interviewing them. Yeah, he's in studio and he is with you and someone else, and you are 2 or 3. But when he's talking like he's seeing 10,000 people. It's like before a crowd. You see that? Because in his mind, he's seeing several people. He's seeing a crowd. He's already in a show. You see that? And have you seen even the language changes? The entire etiquette changes. It has to conform to the addictive world.
Okay.
So you can imagine, even if he goes into a sober space and suddenly, you see, he has to operate in a sober space, he feels very uncomfortable. Do you see what I'm talking about? He has lost control.
Yes, that is so true.
So no matter how much he may be reluctant to take the drug, the problem still will persist, because there is a full biochemical reaction that is pushing him to take a drug, which is the craving. You see what I'm talking about? Then the second part, some people, probably they may be taking drugs, but they remain with willpower.
Okay.
And when they literally make a decision, they are able to take a stand and stop. And sometimes they find purpose in their lives. And that purpose drives them. They spend most of their time pursuing their dream. And that then takes their attention away from the drug. And naturally, it takes a long time, of course, to remove a drug from one system. It takes a very long time. But the fact that they will be on a drug starvation, it means slowly their drug levels are dropping until there's nil. And then what then remains are the residues, which then take a longer time also to weigh off out of the fatty tissues.
Okay.
Yeah.
So the safest way to take drugs is not to take them.
The safest way not to take drugs is to abstain. I think that's the right word. Abstain.
To abstain from drugs.
Abstain from drugs, because when you start, like you said, someone takes once a month, someone takes once a week. What happens is when you take once a month, what will you want to achieve? You want to get a high, isn't it? So the high that you take today may not necessarily be the high that you take next month, because the high that you took last month may not elicit a high.
Okay.
You may need to take higher doses, and then it becomes a higher doses, and it becomes higher doses until now you're an addict.